I am going to be presenting on hippotherapy today. I do have a little bit of help coming in from Teresa to do my PowerPoint for me. So just to, I guess, give a little bit more information about myself, I have been a therapy assistant, so both occupational therapy and physical therapy since 2011. I've always been involved with horses, and so I really wanted to put the two together. So I became a therapeutic riding instructor first, pardon me. And then once they opened up the certification process to do hippotherapy to assistants and not just therapeutic providers such as OT, speech, and PT, then I went to Ontario and got my certification. So if I can get Teresa to pop on my PowerPoint. Okay, so yeah, we're going to talk a little bit about what it is, because a lot of people don't fully understand what hippotherapy truly is and kind of how it can be beneficial to different age populations and kind of what we're looking for within different therapies. If Teresa can go to the next slide. So hippotherapy is essentially the evidence-based practice of purposeful manipulation of equine movement by occupational therapy, physical therapy, and speech language pathology professionals, as well as certified therapy assistants. It is a therapy tool used to engage sensory, neuromotor, and cognitive systems to promote functional outcomes. Our best practice still dictates that hippotherapy should be integrated into a patient's care plan if it's deemed appropriate. So it is provided by OT, PT, SLP, and the assistants who have received specialized postgraduate training through the American Hippotherapy Association. They are currently the only standardized certification program, and that really ensures that providers not only have the clinical reasoning to deem hippotherapy as an appropriate option, but to make sure that they do have the application skills to provide safe treatment. Because hippotherapy, is a very unique therapy, providers have that extensive knowledge base of how human and equine physiology can work together to reach those therapeutic goals. And for that purpose, it is strongly recommended that clients do choose an AHA trained therapist. When clients are referred to hippotherapy intervention, you're actually referring directly to PT, OT, or speech. You're not referring to hippotherapy. And I think that's where it gets confusing for some people, because hippotherapy is not a separate entity. It is simply just another mode of treatment. We can kind of think of it as like pool therapy. When your kids are taken or adults are taken into the pool to do some work, we don't go for just pool therapy, right? We are going for physio or OT or whatever it might be. So the hippotherapy team is a little bit different for, I guess, each individual. But in general, what you would kind of see from a hippotherapy team would be somebody who is leading the horse. So that's usually a specially trained. I prefer to have a CanTRA certified, so a Canadian Therapeutic Riding instructor. I like them to be my leader because I know that they are understanding the movements of the horse and how to ask for those particular movements that I need to see from the rider. So I need to know that, if I'm looking for long, nice drawn out steps, or if I need the horse to get some more lateral movement or get some really short gait to get some concussive movements, I need to know that my leader can do those things, and also that they understand what is happening to the rider. So they are trained and have the knowledge base for many different diagnoses. And so we have to make sure that everybody on the team is aware of what's going on and what we're looking for. We also have a trained side walker, sometimes two. And so that's somebody who's going to walk beside the horse and or assist myself in ensuring that the client is safe and to participate in the session. And then, of course, you have the therapist or the therapy assistant who is trained in hippotherapy to provide the intervention. If you're like myself, and so I'm a therapy assistant, and so I work with either OTs, PTs, or speech. Actually, I have not worked personally with speech yet, as my more of a physio and occupational background, but I do have the ability to do speech as well. But sometimes those providers can be on site as well, or it would just be in kind of, we chat beforehand to see what we're working on, and we come up with a treatment plan, and then we get to work. And then, so we say that hippotherapy is really best completed one-on-one. So depending on the client population, we might be able to do some of the therapy goals in small groups or sometimes couplings. But, if you're really working on those motor skills, one-to-one is the way to go. And I think personally, the best way is to always have that therapist on one-to-one, right? Then you can really get that individual attention. Though a lot of times, we can get some of those speech goals or sensory groups are really great to happen in a group setting. A lot of the times we kind of hear from families that say, hey, I have horses, or somebody I know has a horse. Can we go do hippotherapy there? Is any horse going to do? The short answer is no, although that there are many different ways to implement equines into therapeutic intervention. Each horse must really be the perfect fit for the individual receiving therapy. So some things that we're looking at with horses are, their temperament. Are they calm, quiet? Are they willing animals? I'm a very big believer that animals and people feed off of each other. So if we have a nice, calm, quiet horse, then we can usually get our rider to be calm, quiet. We can get a little bit more relaxation happening. Same thing if we have an excitable child or an excitable horse, right? If our rider is very excitable, that can feed down into the animals. We want to know that they can handle that as well. And if we were to have a more excitable animal, kind of works both ways. That can get our riders and our individuals a little bit more into a higher arousal state. The next thing we're looking at is their movement. So we need to know what the goal of the session is. So a horse with a big barrel swinger, if they're essentially that's their stomach moving, that provides lots of lateral movement. Or do we need short strides for concussion forces, to get that vibration piece? And then we look at conformation. So we need to know that the horse is sound and okay to provide that service. Can they handle the weight of the rider or the potential weight of the extra movement? So if somebody, can sit up, like a typical individual, if they can sit up, hold their own weight, that's much easier on the animal than somebody who is, a little more hypotonic, or they have more spastic movements, things like that. And then we pair the horse with the client who's going to receive kind of optimal gains. And because hippotherapy is not just riding the horse, that horse needs to be able to support those clients in various positions and with different equipment. So with that kind of being said, how would you know if hippotherapy could be appropriate? Or does it sound like fun? Does it sound like something, your child or family member or client might be interested in? So the first thing is always talk with your providers. So along with therapeutic guidance, a physician's assessment and approval is required in order to participate in hippotherapy. We do want to make sure that the client is always safe. If your provider does not do hippotherapy, then chat with a hippotherapy provider. They can be found online. If you go to AHA or the American Hippotherapy Association, you can usually find providers on there. In Canada, we don't have a ton of providers. It's just not as, widely spread around here. So you will hear a lot more about therapeutic riding versus hippotherapy, and we will chat about that in a minute. But because, therapy in general is really a team approach, if your provider does not provide hippotherapy and you want to get involved, chat with somebody who does, and they're going to work with your therapy team. So, we want to know what their goals are. So whether you're coming to hippotherapy for, you think you maybe just want to work more on movement. Well, if it was me, I'm going to ask, what are you seeing from OT? What are you working on in speech? What are you working on with your regular physios? And we match all of that. We want to know what your goals are, and we find a way to integrate that with equine movement. So what would happen is if you were wanting to do hippotherapy, as with all interventions, it's got to be appropriate. So you're going to get a full assessment done by that provider. And because we want to make sure that equine movement is the most useful means to address the impairments, right? So if it can be done in a different way, in a safer way, that's the way that we want to do it. But if horse movement is the most useful or can get a little bit more buy-in from our clients, that's what we want to do. Some baseline considerations to think about if this is something that you're interested in is age. So they have to be over the age of 2. There is no end age limit, but we do want to make sure that, we have some of that head control, some of that cognition. So we like age of 2 is pretty good. Height and weight. So, and that's mostly about, can they be transferred easily and safely, whether it comes in the event of emergencies or just getting on and off the animal. And what is that type of weight, right? Are they able to hold their own weight? Are they requiring full or maximal supports? That all has to be taken into consideration, because that means that the animal has to take more weight, and it does require more abilities from the rest of the team. What are the cognitive abilities like? Can you follow simple instructions? Are there any behavioral concerns? We kind of say, and I don't want to say as a rule of thumb, but if we do have some of those behavioral concerns, we really like it that our riders can follow at least simple instructions, mostly for safety, and the ability to sit. So you don't have to have the ability to sit to do hippotherapy. It's just, if you don't, and we need that moderate or maximal support, then we do have to be put into alternative positions, right? So you're not just sitting upright in horseback, or you might have to have a back rider. And so that's usually with pediatrics for our lighter, smaller riders. And that would be where the therapist is actually on horseback with your rider, helping do our intervention, whatever that may be. Are there fears or anxieties that could be present with working with horses, or even, going to the barn? Sensory dysfunctions, and I kind of sometimes those go together, right? So do we have over under responders? So our over responders might take longer to adjust. Our under responders really crave the input, and so lots of times they really benefit from hippotherapy. It's really fun to see, and tactile discriminations. So when you come into a hippotherapy session, we're at a barn. So we have a new place. There's smells. We have horses, we have dirt, we have all the smells that come with horses, manure, things like that. They do have to wear safety equipment, so helmets. A lot of kiddos usually struggle with that kind of first experience if they're not used to it. Sometimes we use safety belts. Feelings of the horse, right? Getting those hands onto that fur, being able to smell that fur, walking, if they can walk up and down the ramps, getting up onto the ramps, whether they're in wheelchair or being walked. It's a lot of different senses that are being hit. And so we kind of want to take that all into consideration. So in general, most therapists kind of want to see like a registration package before you would come in for an assessment, because we want to know kind of what's the diagnosis, what precautions or restrictions, or what's the mobility like, and has the physician said that this is an okay activity. So because hippotherapy is very unique, right, and it comes with a unique set of risks. So you're looking at, there is always, I guess, the most common, or I should not say it's not common, but the biggest risk would be that fall, right? It is, you're looking at 4 to 6 feet that riders can fall from. And so we want to make sure that it is always done in the safest manner. Falls are very, very rare, but it is a big risk. And because we're doing multi-dimensional movements, right? So can our clients handle the movements, or the movements within the positions? A lot of times we're doing quadruped, we're backwards, we're lying over barrel. So we got to make sure that that's not going to, I guess that the benefits will always outweigh the risks. And then, sorry, I'm just making sure that my PowerPoints, no, I'll get you to pop back one, Teresa. Yeah, thank you, sorry. So we can work on pretty much any goal. It's really it's a dynamic system, right? So we know that multiple systems interact to result in a behavior, and that one change in the system affects the other system. So when we look at the interaction of the movement of the horse with the patient, along with the interactions from all that internal and external systems, it influences both the patient and the horse, and they really work back and forth together. And we see that, changes in the system promote self-organization, and then that will give us change in function. The best thing about equine movement is that it's symmetrical, it's rhythmic, it's organized, and it's repetitive. That's the biggest thing with equine movement, that it's repetitive. And that input affects all of our systems. So our sensory, cognitive, postural, communication, neurologic, musculoskeletal, all of those things are affected, which is amazing. And they're usually affected simultaneously. So some of the things that we see that it influences motor function. So those active responses, reciprocal activation, coordinated responses, control of movement, core. Core is a big, big thing that is always on all the time. And we learn timing of movement. And that kind of comes with our MSK function. So get a lot of pelvic and spine movements, approximation of the joints, that vibration, range of motion is huge. And so if we have low range of motion, where we're really tight, not only the movement of the horse, but the heat of the horse is really great to help relax those muscles. And we learn that postural control. Arousal is a big one that we see because with everything that we do, it really stimulates that emotion center, right? That limbic system. So the upright position, the activation of the posture control goes back and forth and gets our arousal higher. We see respiratory function gains. It's really cool. Some of those kiddos, you know, that breath holding or hyperventilation, we learn kind of unconsciously the timing of breaths. That inhalation and exhalation is actually triggered through the concussion forces as we take steps, as that horse is moving. And so some horses who have what we kind of call like a choppy gait, we can really get a nice firm concussive force that kind of forces us to breathe in time with them. And then we get that approximation, which is assisting with normalizing muscle tone within the diaphragm. And we can also loosen secretions, which is really kind of interesting to see. Lots of times, you know, we get riders up on horses and all of a sudden they start coughing up all of this stuff. And it's really great. So we have had riders who, you know, require suction and all of that, and it can be done. And the circulatory system, so it assists with oxygenation, all that movement. It's a really great non-aerobic, low impact way to get contractions, and that can actually potentially decrease blood pressure. It's that rhythmic activation without strong concussion that we see relaxation be activated, which is really cool. I would say the most common goal that we're seeing is for motor functions. And for motor functions to improve or be learned, we kind of look at it from the motor learning theory, which requires 3 things to happen. And so significant opportunity to practice is the biggest one. And so if we use, say, walking as an example, in a 30-minute session of hippotherapy or a 30-minute session of having equine movement, that's equivalent to 2,500 to 3,000 steps in 30 minutes. Could you imagine walking 3,000 steps in 30 minutes? It's insane and it's great. So we kind of get that rhythmic movement happening and getting a very long, or I guess a large amount of practice in a short amount of time. The feedback. So you need internal, external feedback, failing and succeeding. So our horse's actions provide that internal, external movement, gravity, centrifugal forces, failing and succeeding. So that's, you know, kind of done when we're working on activities, and that's what we learn through feedback. And then the variability of practice. So we get the natural variability from the horse, and plus the implementations from the therapist, you know, things like ground or what we're asking them to do, what kind of patterns we're making the horses go in. And then we just have to be able to have movement exploration. Hippotherapy in general just provides highly organized sensory input, and it's all done simultaneously. So visual input, you know, that identification, relation orientation, vestibular movement, we got that multi-dimensional movements happening, tactile, proprioception, and hopefully we are providing this all in a very meaningful, functional, and we hope that it's very enjoyable experience. Like I said, I don't work too much with speech, but we do know that the speech production systems are benefited throughout. So that's through, you know, some of those respiratory gains, that motor control and timing and rhythm is all really beneficial. I've seen some really cool things done with SLPs who do hippotherapy. And lots of times, if you are in an area who has, you know, different allied health members who are providing hippotherapy, they can sometimes work together, and that's really neat. What does this look like for the CDKL5 population? So a lot of times, I get questions about, well, how can this help my child or my child with this diagnosis? And it really depends on what the diagnosis is. And because CDKL5 is kind of has a wide range of symptomology, it's really dependent on the individual. But when we kind of look at the core symptoms, hippotherapy can potentially benefit low muscle tone for sure. Muscle tone and gait, I would say, are probably the two most common things that we work on, and some of the biggest gains that we see. Fine motor skills, definitely. And honestly, even constipation or bowel bladder complications can be worked on with hippotherapy. Other benefits and goal areas that we can see is within that respiratory and communication functions. And then with the nature of this type of therapy, it offers a really great social aspect with the team, but also with the animal. And it's a lot of times we see the connection with the animal. It's really cool. So with different types of therapies, of course, come contraindications. And the most common contraindication that you're going to see, especially in the CDKL5 population, is regarding epilepsy. And so it really depends on what type of seizures they are having, and how well, or if at all, are they controlled. So for example, anybody who's having grand mal seizures that cannot be controlled with medications are riders that we would not accept into programming, or at least programming on horseback. That's not to say that we can't work on things on the ground, but that would not be a rider who would be able to be mounted on horseback, unfortunately. But there are other things that we can do from the ground with the animal. And then Teresa, I will get you to flip the slide, please. Awesome, thank you. So I just want to chat about hippotherapy and therapeutic riding, because a lot of times the term is used interchangeably, and they're actually not the same thing. So hippotherapy is a therapeutic intervention. It means we are working towards therapeutic goals that are decided by the client and their rehab team. And so it is provided by OT, PT, speech, or their respective assistants. Therapeutic riding or adaptive riding. The AHA really likes to use the terminology adaptive riding, because therapeutic riding does kind of make you think that therapeutic goals are happening. So therapeutic riding or adaptive riding is a challenging recreational activity for those with disabilities. So it's the skill of horseback riding that is taught. People who participate in therapeutic riding definitely gain much more than just learning how to ride. It's a social experience, social interactions, education. We do a lot of education around the animal, saddling, riding. We learn a lot of things. And then balance and coordination, of course, come along with those sensory experiences, but the goal is truly focused around the functional skill of riding. Therapeutic riding also does have a competitive stream, so it is definitely a sport as well. We see hippotherapy is one-to-one. Like I said, we can have a little bit of leeway with groups or couplings, but it's mostly one-to-one. Therapeutic riding is done in a group setting. Sometimes you can have that one-to-one if you're doing kind of private lessons. And so a big difference too, and I realized I did not put on this my slide, is that so therapeutic riding is paid privately, and you kind of do it in like a 6 to 8 week session, and you kind of are building your skills over those 6 to 8 weeks. Hippotherapy, because it is a therapy tool, it can be claimed under insurance, and it is billed to its respective therapies, whether it's occupational therapy, physiotherapy, or speech. Both things can be so beneficial, and I don't want to say that one is better than the other. It really depends on what the goals are with equine involvement. So of course, no matter what avenue you want to choose, it is recommended to ensure that your providers are certified, and that just ensures that you will always receive the safest care and the most appropriate interventions. So therapeutic riding is much more accessible. There's a lot more out there. And depending on what province you're from, Ontario has the most that I've ever seen. There's therapeutic riding almost everywhere you go. BC has a lot. Alberta is kind of hit or miss for where you go. Saskatchewan has a few, a lot more up north. But the one thing that I stress with therapeutic riding is a lot of times people um, market themselves as therapeutic riding instructors or therapeutic riding programs. But just because you're providing lessons to those with disabilities does not mean that those people are necessarily trained. And so I would recommend that if you can't access hippotherapy in your area and you're interested in therapeutic riding, make sure that your instructors are certified. That just ensures that, you know, when you're taking your clients or your family members or whoever it might be to those places, that those instructors have a full scope in knowing what is best. So therapeutic riding instructors, you know, they understand the different diagnoses, they understand what is contraindicated, what things are best, what movements are, I guess, could potentially cause injury. We don't want any of that to happen. And same with hippotherapy. In order to provide hippotherapy, you do have to be a regulated professional, right? It is post-secondary education that happens. And so hippotherapy is, because they're regulated professionals, you know that your care is going to be through those regulated channels, whereas therapeutic riding, it's not a regulated body. Even when you are certified, it's not regulated, but you know that somebody has taken the training and that your clients or your kids or your family members will be taken care of in the best way possible. So I know that that was kind of like a really fast, I guess, introduction into what hippotherapy is. Definitely, if you guys have questions, please email me. I might have some time to answer a few questions right now, but I do have a kiddo at home that I kind of have to run to. But there's so much more to hippotherapy that I can chat about in, you know, a quick 20 to 30 minutes. It's really dependent on what you're working on as to what we can offer, but it's huge. The range of therapy that can be provided is huge. That's all I can say.